How many minutes does a normal man spend or take in bed? A normal man should take 5 to 7 minutes in bed. Normal man should take 5 to 7 minutes, and below 5, we consider that premature ejaculation. We need to know what are the causes of premature ejaculation. Why should someone spend below 5 minutes in bed? 2 minutes, 2 seconds when you are what? When you are in bed. Causes of premature ejaculation could be divided into about 4 to 3 regions. One, we have psychological factors. Psychological factors. In psychological factors, we want to look at the things, for example, anxiety. In anxiety, we are talking about when someone is worried. You give yourself more reasons why your body should activate the defense system. This one can contribute highly to premature ejaculation. Most likely, the new relationships, people having conflicts and others are usually having anxiety. Then we have stress, or even guilt. When you're always stressed and you carry your body, you can't concentrate, you're likely to have issues with your ejaculation. And then we can talk about low self-esteem. Low self-esteem, confidence works hand in hand with proper performance. The moment you lack confidence in what you're doing, you are likely to experience these episodes of premature ejaculation. So you have to be knowing that depression is also a very big factor here. Most of the people are depressed, but they don't want to admit. They have not thought attention from the medical personnel. So depression is a very big factor to consider. Depression is a very big factor to consider. So when you see yourself having issues with ejaculation or with your performance in bed, try to look around your mental health and see whether you're fitting. 2, we can have biological factors. In biological factors, we want to talk about your body. We want to talk about how you do work. We want to talk about how you were made naturally. So I want to start straight with hormones. When you're having hormonal imbalances to a less extent, for example, low testosterone, we have hormones which are responsible for making a man in a strong sense of it. So hormones like testosterone, when they are low, and you have stress hormones when they are high, for example, cortisol, issues of serotonin and others, they can make a man have premature ejaculation. We cannot exclude prostate issues, BPH, we have prostatitis due to infections, we have prostate cancer, and other many issues with the prostate. These are biological issues. When you have them, you are likely to have a premature ejaculation. At the same time, we can talk about erectile dysfunction. There are men who have erectile dysfunction. For them, they fear to ejaculate faster. So in that sense of fearing to ejaculate faster, they actually do ejaculate faster. The fear not to perform also causes this. So in biological, let's stop at that. We shall be explaining more about that. Other factors, I want to talk about techniques and skills. People do not know that sex is a game, and it needs someone to be with proper techniques. You need to be knowing techniques. For example, ejaculation control, the hold and release, in case you have issues with ejaculation. So you need to know the techniques, how to perform styles and others. At the same time, we cannot exclude substances. Some of you are on drugs that you don't know the causes. When you're taking a drug, know how the drug will affect you. Most of these drugs will eventually affect you. Even other alcohol, other substances, marijuana and others, they can really contribute to premature ejaculation. Meanwhile, in our next video, we shall be seeing how do these mental factors affect someone, or how do they cause premature ejaculation and others. See you in our next video. Please like and subscribe.